Welcome to LPN LaunchPad's Level of Consciousness Assessment for Nursing Students. This session will review essential LOC assessments, including the Glasgow Coma Scale, AVPU scale, and related clinical considerations. Assessing a patient's level of consciousness is a fundamental aspect of neurological evaluation. It determines patient awareness and brain function, guides early treatment interventions, and helps identify neurological deterioration. LOC assessment is especially critical in trauma, stroke, and critical care settings where rapid deterioration can occur. The Glasgow Coma Scale, or GCS, is a standardized tool for assessing level of consciousness. It consists of three components: eye opening, verbal response, and motor response. Each category is assigned a numerical value, and the total score ranges from 3 to 15. A lower score indicates more severe neurological impairment. The eye-opening response is scored from 1 to 4. A score of 4 indicates that the patient opens their eyes spontaneously. A score of 3 means the patient opens their eyes in response to verbal stimuli. A score of 2 indicates the patient only opens their eyes in response to painful stimuli. A score of 1 means the patient does not open their eyes. The verbal response component assesses the patient's ability to communicate. A score of 5 indicates the patient is oriented and converses normally. A score of 4 suggests confusion, but the patient can still communicate. A score of 3 means the patient uses inappropriate words. A score of 2 consists of incomprehensible sounds, such as moaning or groaning. A score of 1 means there is no verbal response. The motor response evaluates a patient's ability to move in reaction to stimuli. A score of 6 indicates the patient obeys commands. A score of 5 means the patient localizes pain by moving toward the painful stimulus. A score of 4 means they withdraw from pain. A score of 3 indicates abnormal flexion, known as decorticate posturing. A score of 2 indicates abnormal extension, known as decerebrate posturing. A score of 1 means there is no motor response. The interpretation of the Glasgow Coma Scale is critical for guiding clinical decisions. A score of 13 to 15 suggests a mild traumatic brain injury. A score of 9 to 12 indicates a moderate traumatic brain injury. A score of 8 or below signals a severe brain injury or coma, necessitating airway management and urgent intervention. Patients with a GCS score of less than 8 are at high risk of mortality and require immediate neurological assessment. In addition to the GCS, alternative methods for assessing LOC include the AVPU scale. This scale categorizes patients as alert, responsive to verbal stimuli, responsive to painful stimuli, or unresponsive. Other key assessments include pupillary response, known as PERRLA, and brainstem reflex testing, which evaluates the gag, cough, and corneal reflexes. Altered level of consciousness can have neurological or metabolic causes. Neurological causes include traumatic brain injury, stroke, increased intracranial pressure, seizures, and brain tumors. Metabolic causes include hypoxia, hypoglycemia, electrolyte imbalances, drug overdose, and sepsis. Identifying the underlying cause is essential for proper intervention. Key nursing interventions for altered LOC include ensuring airway, breathing, and circulation, commonly called the ABCs. Frequent neurological checks using the GCS are necessary to monitor changes. If increased intracranial pressure is suspected, raising the head of the bed and preventing straining can help. Continuous monitoring of vital signs and oxygenation is essential, and imaging studies such as CT or MRI may be needed for diagnosis. In summary, level of consciousness assessment is critical in neurological evaluations. The Glasgow Coma Scale remains the gold standard for assessing consciousness, while A, VPU, and pupil examinations complement GCS findings. Early recognition and intervention improve patient outcomes, and accurate documentation ensures effective communication among healthcare professionals. When answering NCLEX-style questions on LOC assessment, prioritize airway, breathing, and circulation. Recognize early signs of neurological deterioration, particularly a decreasing GCS score. Identify the most urgent intervention, especially in patients with altered consciousness. Differentiate between normal and abnormal findings, and use elimination strategies to rule out incorrect options. Always focus on patient safety. Now, let us apply these concepts with a practice question. A patient is admitted with a head injury and a GCS score of 7. Which interventions should the nurse prioritize? A. Monitor blood glucose levels. B. Encourage oral hydration. C. Prepare for intubation. D. Apply warm blankets. The correct answer is C. Prepare for intubation. A GCS score of 8 or lower indicates a compromised airway, requiring immediate intervention. Airway protection and mechanical ventilation are essential to prevent further complications. Which of the following GCS motor responses is most concerning? A. Withdrawal from painful stimuli. B. Localizing to pain. C. Decerebrate posturing. D. Following verbal commands. The correct answer is C. Decerebrate posturing. This response indicates brainstem damage and is associated with a worse prognosis compared to decorticate posturing. Decerebrate posturing suggests severe neurological injury requiring immediate intervention. A nurse assessing a patient notes they respond only to painful stimuli with incomprehensible sounds and withdraw from pain. What is their GCS score? A. 9B, 6C, 10D, 7. The correct answer is D, a GCS score of 7. This is calculated by assigning 2 points for eye opening in response to pain, 2 points for incomprehensible sounds, and 3 points for withdrawing from pain. A score of 7 indicates severe brain injury and requires close monitoring.
Hey there, this is Brian. I am the creator of LPN LaunchPad. I want to say thank you for learning with us. In addition to these videos, I've created a series of free adaptive quizzes in ChatGPT. The link to this video's quiz will be listed in the description below. Help me keep this project alive by hitting the like and subscribe buttons.